A brain tumor is a growth of cells in the brain that multiplies in an abnormal, uncontrollable way. It is graded according to how fast it grows and how likely it is to grow back after treatment. Grade 1 and 2 tumors are low grade, and grade 3 and 4 tumors are high grade. There are two main types of brain tumors: non-cancerous benign brain tumors. These are low grade, grade 1 or 2, which means they grow slowly and are less likely to return after treatment. Cancerous malignant brain tumors. These are high grade, grade 3 or 4, and either start in the brain, primary tumors, or spread into the brain from elsewhere, secondary tumors. They're more likely to grow back after treatment. The Cancer Research UK website has more information about specific types of brain tumors. The symptoms of a brain tumor vary depending on the exact part of the brain affected. Common symptoms include headaches, seizures, fits, persistently feeling sick, nausea, being sick, vomiting, and drowsiness. Mental or behavioral changes, such as memory problems or changes in personality, progressive weakness or paralysis on one side of the body, and vision or speech problems. Sometimes you may not have any symptoms to begin with, or they may develop very slowly over time. When to see a GP? See a GP if you have these types of symptoms, particularly if you have a headache that feels different from the type of headache you usually get, or if headaches are getting worse. You may not have a brain tumor, but these types of symptoms should be checked. If the GP cannot identify a more likely cause of your symptoms, they may refer you to a doctor who specializes in the brain and nervous system, neurologist, for further assessment and tests, such as a brain scan. Brain tumors can affect people of any age, including children, although they tend to be more common in older adults. More than 11,000 people are diagnosed with a primary brain tumor in the UK each year, of which about half are cancerous. Many others are diagnosed with a secondary brain tumor. The cause of most brain tumors is unknown, but there are several risk factors that may increase your chances of developing a brain tumor. Risk factors include age. The risk of getting a brain tumor increases with age. Most brain tumors happen in older adults aged 85 to 89, although some types of brain tumor are more common in children. Radiation. Exposure to radiation accounts for a very small number of brain tumors. Some types of brain tumors are more common in people who have had radiotherapy, CT scans or X-rays of the head, and family history and genetic conditions. Some genetic conditions are known to increase the risk of getting a brain tumor, including tuberous sclerosis, neurofibromatosis type 1, neurofibromatosis type 2 and Turner syndrome. The Cancer Research UK website has more information about the risks and causes of brain tumors. Treating brain tumors. If you have a brain tumor, your treatment will depend on the type of tumor, where it is in your brain, how big it is and how far it's spread, how abnormal the cells are, and your overall health and fitness. Treatments for brain tumors include steroids, medicines to help with symptoms, surgery, radiotherapy, and chemotherapy. After being diagnosed with a brain tumor, steroids may be prescribed to help reduce swelling around the tumor. Other medicines can be used to help with other symptoms of brain tumors, such as anti-epileptic medicines for seizures and painkillers for headaches. Surgery is often used to remove brain tumors. The aim is to remove as much abnormal tissue as safely as possible. It's not always possible to remove all of a tumor, so further treatment with radiotherapy or chemotherapy may be needed to treat any abnormal cells left behind. Treatment for non-cancerous tumors is often successful and a full recovery is possible. Sometimes there's a small chance the tumor could return, so you may need regular follow-up appointments to monitor this. The Cancer Research UK website has more information about treatment for brain tumors. If you have a brain tumor, your outlook will depend on several factors, including your age, the type of tumor you have, where it is in your brain, how effective the treatment is, and your general. Taken from nhs.uk. Please subscribe to my channel. Thanks for watching.